Bismillahirrahmanirrahim. Welcome to today's lesson on muscles of the eyeball. The eyeball has extrinsic muscles and intrinsic muscles. First, we'll discuss the extrinsic muscles, which are basically 6 muscles: the superior rectus, the inferior rectus, the medial rectus, the lateral rectus, the superior oblique, and the inferior oblique. So first of all, we'll discuss the superior rectus. The superior rectus has its origin from the tendinous ring on the posterior wall of the orbital cavity, and it has its insertion at the superior surface of the eyeball, just posterior to the corneoscleral junction. It has its nerve supply from the oculomotor nerve, the third cranial nerve. Its action is to raise the cornea upward and medially. The second muscle is the inferior rectus. The inferior rectus muscle had its origin at the tendinous ring on the posterior wall of the orbital cavity, the same place from where the superior rectus had its origin. Its insertion is at the inferior surface of the eyeball, just posterior to the corneoscleral junction. It has its nerve supply from the oculomotor nerve, the third cranial nerve, and its action is to depress the cornea downward and medially. The third muscle is the medial rectus. The medial rectus muscle also has its origin from the tendinous ring on the posterior wall of the orbital cavity, and its insertion is at the medial surface of the eyeball, just posterior to the corneoscleral junction. Its nerve supply is also from the oculomotor nerve, the third cranial nerve, and its action is to rotate the eyeball so that the cornea looks medially. The fourth muscle is the lateral rectus. The lateral rectus muscle has its origin from the tendinous ring on the posterior wall of the orbital cavity, and it has its insertion at the lateral surface of the eyeball, just posterior to the corneoscleral junction. Its nerve supply is from the sixth cranial nerve, the abductor nerve, and its action is to rotate the eyeball so that the cornea looks laterally. The fifth muscle is the superior oblique. The superior oblique muscle has its origin from the posterior wall of the orbital cavity. Its insertion is at the superior surface of the eyeball beneath the superior rectus after it has passed through the pulley, also known as the trochlea. Its nerve supply is from the trochlear nerve, which is the fourth cranial nerve, and its action is to rotate the eyeball so that the cornea looks downward and laterally. Finally, the sixth and the final extrinsic muscle of the eyeball is the inferior oblique muscle. The origin of the inferior oblique muscle is from the floor of the orbital cavity, and its insertion is at the lateral surface of the eyeball deep to the lateral rectus. You can also see the inferior oblique muscle in this figure. The nerve supply of the inferior oblique is from the oculomotor nerve, which is the third cranial nerve, and its action is to rotate the eyeball so that the cornea looks upward and laterally. Alright, now we'll discuss the intrinsic muscles of the eyeball. The intrinsic muscles of the eyeball are basically smooth muscles, and they are the sphincter pupillae, the dilator pupillae, and the ciliary muscle. Number 1, the sphincter pupillae. The dilator pupillae. Number 3, the ciliary muscle. Alright, so first of all, we'll discuss the first intrinsic muscle, which is the sphincter pupillae. So the sphincter pupillae is basically, it has its parasympathetic nerve supply via the oculomotor nerve. This is the sphincter pupillae, and its action is to constrict the pupils. As you can see in this diagram, this is the dilator pupillae muscle, the second muscle. So it has a sympathetic nerve supply, and its action is to dilate the pupils. So when dilator pupillae muscle is stimulated or contracted as a result of the sympathetic response of the body, it dilates your pupils. So the third intrinsic muscle of the eyeball is the ciliary muscle. The ciliary muscle, as you can see, the ciliary muscle has circular fibers and it has meridional fibers. It has a parasympathetic nerve supply via the oculomotor nerve, and its action is to control the shape of the lens in accommodation and makes the lens more globular. So this brings us to the end of intrinsic muscles of the eyeball. And before bringing this lesson to an end, we'll just generally mention the muscles of the eyelids. There are basically two muscles of the eyelids: the orbicularis oculi and the levator palpebrae superioris. So the first one is orbicularis oculi. The orbicularis oculi has two parts, the palpebral part and the orbital part. The palpebral part has its origin from the medial palpebral ligament, and its insertion is at the lateral palpebral raphe. Its nerve supply is from the facial nerve, and its action is to close the eyelids, and it dictates the lacrimal sac. While the orbital part of the orbicularis oculi muscle has its origin from the medial palpebral ligament adjoining and the adjoining bone, and its insertion is its loops basically return to its origin because it's a circular muscle, and its nerve supply is from the facial nerve, and its action is to throw the skin around the orbit into folds to protect the eyeball. And the second muscle is the levator palpebrae superioris muscle, which has its origin at the back of the orbital cavity, and its insertion is at the anterior surface and the upper margin of the superior tarsal plate. The nerve supply of the levator palpebrae superioris is basically the striated part had its nerve supply from the oculomotor nerve, while its smooth muscle part had its nerve supply via the sympathetic nerves, and its action is to raise the upper lid. This brings us to the end of the lesson on muscles of the eyeball and the eyelids. Thank you.